So the challenges for pharmacists come that there are many drugs across many indications, and so from a pure formulary perspective, which ones do you have, which ones do you need, and how can we really pick out the patient who will respond better or have a higher likelihood of response? Because these drugs are costly, and they certainly can add up over time, and if you can find a patient who's unlikely to respond, that helps the patient get a therapy that will respond and also has the ability to save money for the healthcare system as a whole. The challenge is that our filters for figuring out who's going to respond and who's not going to respond are not as clear as they are with other types of biomarkers, for example, EGFR mutations. And so the one thing we also don't want to do is not treat a patient who may potentially respond despite the fact that their biomarker is low. And there are those patients out there. I think the audience engagement was great for the session. Certainly the number of attendees was very large, and that just reflects the idea that, number one, immunotherapy is and is going to continue to be a critical part of cancer treatment. And secondly, with the cost as well as the possibility that patients may not respond to these treatments, how do we better define the population of patients who are going to respond and potentially move to other therapies in those that we know are not going to respond? And that's where the debate lies.